Well, good morning and welcome to another episode of the Health Hub. I'm Garry Borman. I'm a qualified naturopath, nutritionist and herbalist, and I've been in clinical practice for a while, over 14 years now. So what we do with the Health Hub is each week we try to bring along some information that's been in the headlines, what might be relevant, what might be topical, and put it into some sense, take out all the BS and add a little bit more relevant information in there so that you might benefit for yourself, friends, family, small furry animals, whoever you might think will get some gain from this. So if you do like this segment, go ahead, feel free, share away. It's all good, and if people want to actually come and see me, I do see people in clinical practice. Even in COVID-19 lockdowns, we are getting the ability to do remote consults, so using things like Skype and Zoom, etc. Alright, well, let's get into it for another week. Start the timer, got the water, we're good to go. The obligatory disclaimer. The following segment should be considered as information, education and entertainment only. It is not designed to replace professional, individualised recommendations and does not infer ceasing prescription medications. If the information presented here causes concerns about your current health regime, discuss these concerns with the prescribing clinician or a qualified healthcare practitioner in a proper clinical environment. As I say every week, that doesn't mean go down to a local health food store and have a quick chat. They're not in a position to discuss all of your diet lifestyle and take into account what drugs you might be on and therefore avoiding any problems that might come up. It also doesn't mean talk about it to the person as you're walking your dog down the beach or down the road, and do not go talking to people who've just taken on their latest MLM and suddenly they're an expert because they've now got pills to sell you. And they'll get a little bit of commission for every pill they can sell you. They can give out some of the worst information around, and one of my previous episodes talked about how one of those MLMs did get pinged for telling porkies to people. Anyway, this week, you'll notice we're not using episode numbers now, so I can chop them and change them. We've got chronic pain and the way it changes your brain works. A bit of interesting research there. Burnout, the modern epidemic. And diet sodas, don't mix it with carbs. And the word soda, you can tell this article's come from the US. And this week, like others, you might notice that it is brought to you by My Active. So I'll talk a little bit about that straight after the pain article. This is really an interesting one. A researcher from Australia actually found that chronic pain can lead to a depletion of a chemical called glutamate in the brain. And with this depletion, the researcher, Associate Professor Sylvia Gustin, found the lower the levels of glutamate, or the higher the decrease, the more people are prone to feeling tired, unmotivated, and constantly worrying on a daily basis. They also found that the greater the depletion, basically the more chronic pain sufferers showed fearfulness, pessimism, fatigue, and sensitivity to criticism. So we all know that when you hurt, you basically aren't at your best. You get quite short-tempered, you can certainly be a lot more moody and testy, but this is probably the first thing I've seen that they've gone measuring chemical changes that might have gone on and some of the reasons behind why people are different personalities when they're in pain. I know that certainly what got me into natural medicine. When I had a car accident, I was popping painkillers like Tic Tacs, and the mainstream docs say didn't have a problem with that. I was the one who had a problem with that because, when I didn't take them, my mood was extremely short. But what they've, Dr. Gustafsson, or Associate Professor Gustafsson, has said they've called glutamate a key chemical messenger between brain cells that helps regulate emotion, and that the low level means their brains can no longer communicate properly, and therefore the ability to process positive emotions is jeopardised. Only small sample, only 19 patients, but they used MRI scans as well, because you couldn't pick up depletion of glutamate with MRIs, but found that almost half the people with chronic pain had mental health conditions like depression and anxiety, and these findings might explain why. They went on to say there are currently no medications which target reduced levels of glutamate in the brain. And, well, I suppose that's correct because it's called nutrition. Where I talk about a lot of my patients, we talk about glutamic acid, which is interchangeably used with glutamate. Very small chemical difference, one hydrogen atom. But glutamic acid and GABA, so gamma-aminobutyric acid, these are all derived from the amino acid glutamine. And there might be a bit of nerd speak in this, apologies in advance. Essentially, how I describe it to people, we've got the brake versus the accelerator. So GABA, so the gamma-aminobutyric acid, that's the brake pedal for the brain, and that's what most people aren't managing very well, and that's where a lot of the anti-anxiety drugs get there, because, you know, their mind's just running away, that little hamster on the wheel thing going on. Whereas glutamic acid, it's the accelerator, so it's the let's get motivated, let's get the brain moving along, and that's sort of one of the things postulated in stuff like ADHD, that hyperactivity part. Basically, you know, the foot's flat to the floor on the gas, and that's the hyperactivity part, so too much glutamate going on. And it's something I've used with some kids in the past. We use a little bit of glutamine to try and get more available glutamine down the GABA pathway, and it slows them down. So pretty cool there. So what we also know is that glutamine is what they call a shuttle for glutamate. So if someone is really low in glutamine, this could potentially be what's leading to this deficiency of glutamate and why they're losing all their their drive, their happiness, basically their mojo. Now, why could this happen? You know, I got some thoughts on there. You know, glutamine is the most abundant amino acid in the body. I should put my better false teeth in this week. It's used in tissue repair. It's used for mood, we know that. Used for determining IQ. So if you're thinking a lot, you actually can benefit from using some glutamine. It's actually really cool. I used that when I was a student. Gut repair, and we know the gut turns over very, very quickly. We're turning over cells in there all the time, so I use it a lot for stuff like leaky gut also. Fantastic there. And the immune system, because it's food for white blood cells. So we actually have the body having a high demand for glutamine. So if people's diets aren't getting there, this could potentially be one of the causes. We know that when you've got chronic pain, you tend to have chronic stress as well. Diet goes off, you might not be eating as well as you could. So just throwing it out there, maybe we might see some benefits in there. But the cool thing here, where we go to, is that we see drugs like Lyrica, which I've spoken about in the past, which is really not a very nice drug. Yeah, it does a thing, but used for chronic nerve pain that they really can't get on top of. It is what we call a GABA analog, so it's GABA and then broken down into another substance. Maybe this is why sometimes that the Lyrica doesn't work for people, because they need to actually push up the glutamate or glutamic acid pathway. I don't know, just throw it out there, but it's cool that someone is doing some of that research, because it is universally accepted. We're taking way too many painkillers. The opioid crisis is thrown around in Australia as well as the US, and it's not doing people any favours. So we need to come up with better options and understand why people are so addicted to our painkillers, and especially after that stuff going on. Which I suppose is a pretty good segue into this week's sponsor of MyActive. Now MyActive, what we're calling the arthritis pain breakthrough. Look at the big banner, it's probably better. So many people suffer from arthritis. Different countries have a greater incidence of it, but we know just from numbers in Australia, at least 1 in 5 over the age of 50 have got arthritis. And you come up with those numbers because they're the people that are presenting to the GP and going, I've got pain, and it's recorded on patient records saying, oh, I believe you've got arthritis. So it's probably way higher than that. And a lot of it comes down to nutritional deficiencies, and that was the basis behind the development of MyActive. It was looking at what chemicals the joints need and what is often lacking in the typical Australian diet especially. So we put that together, we came up with some prototypes, and lo and behold, a lot of results came through that were very, very positive. So super cool there. So MyActive, certainly worth trying, because it's starting to cool down now, and a lot of people experience more arthritic pain going into the cooler months. So especially those with rheumatoid arthritis tend to suffer a lot more. And that is something we've had some good results with people. So MyActiv.com. Do yourself a favour, do your parents a favour. get them started in my active, and they might have a way better winter with a significant reduction in any pain and discomfort, or they might even be totally pain-free, be running up and down those beaches when they're allowed to. Okay, that's probably a good time to move into the next story. They're talking about burnout. Is it the modern epidemic? ABC ran an article, Depression, Exhaustion and Burnout, what's the difference? And well, they all sort of fall into convoluted grey water, actually. One of my favourite books we talk about here, this guy James Wilson, he's Canadian, called Adrenal Fatigue, the 21st Century Stress Syndrome. And I suppose we'll lead into that a little bit later. We'll start with the article. So in January, a BuzzFeed journalist called Anne Helen Peterson, she wrote an article on how millennials became the burnout generation, detailing specific kind of malaise that made even the most basic tasks feel overwhelming and impossible. Millions of readers recognised themselves in her piece and exploded in mainstream consciousness. Not controversies. People described themselves as having feelings of hopelessness, exhaustion, apathy, frustration, and it was hard to differentiate this from whether it was depression or chronic fatigue. I think they all do sort of fall into that same area. When you're chronic fatigue, you're tired. You know, if you've got depression, you certainly don't have that drive. That's one of the hallmark symptoms. So we have a gentleman by the name of Michael Leiter, Leiter, Professor of Industrial and Organisational Psychology at Deakin University. He's come up and he's said that burnout is made up of three parts. Exhaustion, you then become cynical, and basically you don't give a shit at work, and then a lack of efficiency, again at work. He seems to think that this is all based around a workplace issue and that it isn't a disease at all, but it leads to a disease that he calls depression. Interesting, he's used the term disease. That can have a bit of a stigma to it, but it does fall in line with a thing called the DSM. When the DSM was first produced back in the 60s, I believe, it was like this. It was 16 pages thick, and it was produced by psychiatrists because psychiatrists still had to go through all the same medical training, but they were basically belittled by their peers, saying that if you don't have a disease, you've got nothing to treat. And if you don't have a drug to treat that disease, then it's untreatable, so you're not really a doctor. So the DSM was developed, and they started defining all of these conditions for anxiety, depression, mental health, etc. So it went from 16 pages to the DSM-6 is about that. It's about an inch thick, you know, in the old standards, 2.5 centimetres. So there's a lot of pages now. And things like if you feel sad because your parent has died, apparently that is an emotional disorder this time. Funny, I would have said that that's called being a human. Even some of our animals experience that, so I don't think that that's a disease at all or any sort of bad medical condition. But yes, for those who are wondering how we could equate burnout to clinically diagnosable illnesses, it's worth noting WHO have offered burnout under the International Classification of Diseases, the ICD-11. And WHO was careful not to call burnout a medical condition, and yet they called it a disease, but defining it as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. Now, I really think that putting it into this workplace only category is terribly incorrect. Now, a lot of it can stem from there. Yep, we spend the majority of it at our time at work, working for somebody else for the majority of the population, I'd expect as well. And workplace bullying goes on. The expectations of what you need to do can often not align with your own values, and that can cause a large problem with people. But I like to refer to psychologists for various conditions when I see people being pretty stressed and burned out, in using my term. And in the ensuing conversations, it's funny where we see a lot of other conditions coming from, and I'm going to call it adrenal fatigue, not burnout, but from the adrenals getting very, very tired. We know that it leads to a lot of issues at home because people are always tired, they're fatigued, they're moody, and that starts having a big impact on their relationships. And I know marriage counsellors that I talk to, they basically say in just about every case where there's marital problems, at least one of that couple is experiencing what they will call adrenal fatigue, because their mood is short and their perception on a lot of things gets suddenly slanted too. So things that never used to bother them really become major issues. And one of the more bizarre things I came across many years ago, one person said, my partner chews their food wrong. And was, sorry, and they go, I know, this is insane, but it's little things like that that are really bothering me and I need some help. Now, it was fantastic. They recognised that that was quite an abnormal response to what was going on. And these are the sort of things that they, if you don't start getting some help, they start having a massive impact on the relationship, and things fall apart for really quite trivial reasons that, you know, normally you wouldn't think twice about an eyelid about them. Now, other things that start coming up is digestive issues. We know that brain-gut link, it's very, very strong. So that state of brain, state of gut. So if you're really stressed here, the gut is really stressed. So we see food sensitivities start to increase, and overall digestion starts to wane. It's nowhere near as effective, so you don't get as much goodness out of your food at a time when you probably do need a little bit more to help cope with those stresses, you know, especially your B vitamins. So adequate nutrition is actually the cornerstone to treating this. General health problems also pop up, especially weight gain. We know that it mucks around with insulin production, so your sugar management, which is why your energy levels are going up and down. But we see a lot of weight gain, especially around the trunk, and that's one of the things that I look for with very active people. They might present for weight loss, and you know, they'll eat a carrot stick and a couple of bits of celery a day, and that's all, and they do 10,000 sit-ups and 100 push-ups and blah, 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 and they can't lose any weight. And we talk about where it all is. You know, the shoulders and arms are toned, legs are toned, but flabby around the middle. And they go, well, tell me about stress. And they go, oh, stress, my God. And they just pour it all out. And that's because one of the stress chemicals known as cortisol, part of its mechanism of action is to redistribute fat from the periphery, so think around the arms and everywhere else, and put it around the trunk. So when you're really stressed, your body wants to start putting weight around the middle. And that's why people are struggling to lose it. They can even be so focused on trying to lose weight, they're stressing themselves, making the problem even worse. That classic catch-22. So we can't underplay stress, burnout and fatigue and how it is in the modern workplace. We just need to understand that it is a real thing and how the best ways are to approach that. And it's not high dosage therapy. It's actually quite low, because we've got the digestive system and the whole assimilation system that's impaired. We like to use low doses of things like especially B group vitamins. You know, we might throw some glutamine in there even, just to help with mood and digestion, and certainly our adrenal herbs, you know, especially Romania, it's one of my favourite herbs for that, really helps restore those burned out adrenals. And I actively refer to psychologists for this, because we need to give people techniques in how they can deal with these stressful situations that might be going on at home, or, as they did identify, a lot of this does stem from the workplace as well. So we've got to not let people get so wound up and having physical manifestations of the stress, but how can they deal with that, and other things to help, you know, get out, going for a walk, what they call grounding, you know, sit out in your grass, bare feet, and just get in touch a little bit with nature and relax. And don't go to stuff like alcohol, gambling, or other abusive behaviours that can come into place too. We see gambling addiction in some people that are so stressed they like the thrill of winning. Yeah, so it is a very real thing. Finding someone who knows what they're talking about, not just calling it a workplace thing, I think that's really quite belittling to a lot of people that have stress in their life. Certainly I've seen some people they've been carers for their family, and their family's been quite unwell with numerous medical conditions, and it has a massive impact on their energy and their overall outlook. So we have to work on that at all levels, mind, body, spirit. All right, moving forward into the next article for the day, final one for the day. What are we at? 18 minutes. So probably a shorter one this week. Now, diet soda, don't mix it with carbohydrates. So yes, the word soda is in there, and that's because this came from a study at Yale University, so quite a reasonable sort of establishment to go putting this out. Anyone who's known me for a while knows I'm a hater of artificial sweeteners and diet drinks in particular, and there's plenty of data around. It's been circulating for years on how diet drinks don't help with weight loss, and they can actually go the other way and cause more weight gain. A lot of these stories, they've just been hidden away in more obscure things. You have to seek them out. So it's not a sexy thing for mainstream to go, don't go having your Diet Coke because it could put weight on you. Not when Coke's paying them a lot of money in sponsorship and advertising segments, sponsoring the Olympics at times. So this is why you don't use the brand names. You just have to be careful and sort of say diet drinks, diet sodas, diet soft drinks. Anyway, senior lecturer and neuroscientist Dana Small. She grabbed 45 people between the ages of 20 and 45, divided them into a couple of groups, and found that those that were given artificial sweetener, it was only a short study over 2 weeks too, they had notable changes in their brain chemistry, so in little as 2 weeks. And at one stage, when they were doing a little bit more, they actually only 7 days, and they were still noticing changes in brain chemistry. So very, very fast in how these artificial sweeteners can wreak some havoc with the way that your mind and your body works. She went on to say that previous studies have shown that changes in the ability to use sweet taste as a guide to behaviour can lead to metabolic dysfunction and weight gain over time. That's a really complex way of saying you eat more. So you're taking these diet drinks, but you just tend to eat more. We think this is due to the consumption of artificial sweeteners with energy. And the story I've been telling patients of mine for a fair while now is the way that the body works. We've only started consuming a lot of sugar-based products in the last 100 or so years. When you go back and you look at the numbers, it was something like only a few pounds or a couple of kilos per year for the average person, and now it's something ridiculous like 200 pounds consumed per year in sugar from all sources, and that can be refined foods like breads, etc. But even if we said 100, let's scale that back a lot. It's like 50-fold what 2 or 3 generations back we're consuming. So massive amounts of energy getting consumed, whereas before we didn't have it because our bodies had gone, wow, when I can come across something quite sweet, this is usually something that's got plenty of energy in it. And they go, this is a great thing because the way our body works, if we have excess energy consumed, in the form of glucose, let's say, the body converts that into fat. And it says, well, if I don't have any food for a little while, because 3 meals a day certainly wasn't a thing even 2 generations back. We experienced very much the highs and lows of drought and famine. So the body would go, I need to call on those stores and put it back in. So with people that struggle with weight, some of them may have a very efficient, what has been called the thrifty gene. So their ability to store away any little bit of energy that they don't use, they turn it into fat. And as soon as they need it, they convert that fat back into sugar or back into energy for regular living. People with a fast metabolism like me, if I was on a desert island, I would be in trouble. Whereas those with this thrifty gene, they would survive much, much longer than I could because they're very efficient in how they use their energy. So what does all this mean? Well, that sweet taste that we get, the body's going, oh, sweet taste, hey, I know this is a good evolutionary thing. Sweet taste means I've got high energy food coming, so I'm going to throw as much of this stuff in as I can because I don't see it very often. I'm going to make some fat so when I don't have a meal, I can convert some of that fat back. Now that was great for 100 years ago. It's not so great in 2020 where there is an overabundance of high energy foods. Think those highly refined foods, which are breads, which are biscuits, which is, muffins, take your pick. We've got so many things with extra sugar added into it. It's just not funny. So when we refine grains, we make a lot of high energy food in the form of starches as well. Potatoes, they're the classic. We consume a lot of potatoes that historically we probably didn't. Some countries did consume a lot more, but others didn't. So lots and lots of energy. The output isn't there because we're becoming more sedentary. And so when you start having this sweet sensation that says, hey, that energy you've got, store it away, that's where we lead to a lot of weight gain. And that's the only reason that we can possibly come across as to why artificial sweeteners would lead to weight gain, because when you look at them, they contain 0 calories. They've got no energy, so they shouldn't contribute in any way, shape or form to the body putting on extra weight. So it's got to be this secondary mechanism with the food that's being consumed. And where, didn't say what Dana Small was, whether she's a professor or a doctor or whatever, she basically said, if you're going to eat French fries, you're better off having a regular Coke. Or better yet, water. So yeah, we'll go with that part, better yet, water. So that was very interesting that she's actually gone, yeah, these diet drinks are worse for you than a fully blown soft drink. And we know your average 375 gram can of soft drink is going to have 30 plus grams of sugar, which, you know, doing the maths, it's about 4.2 grams of sugar per teaspoon. So you're up around 7.5, 8 grams. 7.5 to 8 teaspoons of sugar in that can of soft drink. And that's a 375. So if you're drinking the 600 mils, like are pretty common in Australia, that's around 50 odd grams of sugar. So doing the maths again, by 4, you know, carry the 2, that's a lot. That is a real lot. So you're up around there, you're at 12 teaspoons of sugar. Would you sit down and put 12 teaspoons of sugar on your breakfast cereal? No, but you would throw down a 600 ml soft drink with lunch. Something to think about. So that's a wrap for this week. 25 minutes in, went a little bit longer than I actually thought we might this week. So hopefully you've got a little bit out of this and I didn't waffle too much. But if you do feel that there is some gain and it's worth sharing with others, absolutely share that, because knowledge is power, and if we can look after each other, that's going to make us a lot healthier and happier in the world. So until next week, be kind to a stranger, because one day that stranger just might be you.